Hello and welcome to the Child and Adult Care Food Program Infant Feeding Requirements Training. This training will review the requirements for infant feeding for the Child and Adult Care Food Program. Some of the information in this presentation will apply when an agency chooses to claim the meals served to infants for reimbursement. Any agency or site that participates in the CACFP must offer program meals to all children enrolled. This includes infants. With the CACFP, an enrolled child is defined as a child whose parent or guardian has submitted a signed document to this institution. This document indicates that the child is enrolled for care. Additionally, the definition of an infant for CACFP is a child who has not yet reached their first birthday. If an agency or site is operating CACFP and is licensed to provide care to infants, then the facility is required to offer a reimbursable meal to the infants in care. This includes offering at least one option of iron-fortified infant formula. Agencies are encouraged to offer a brand of formula that satisfies the needs of one or more infant. It is important to understand the facilities are not required to offer multiple formula types. If a parent declines formula options at the facility, the parent may opt to provide their own. We encourage facilities to get that decision in writing from the parents. This is not a requirement, but it is encouraged. There are 2 prototype forms available. Please contact CANS for more information. There are several different sample forms in the Feeding Infants Manual. These can help get information from families related to infant feeding. Please contact CANS for more information. In addition to offering at least one choice of iron-fortified infant formula, facilities are required to offer a full meal with all required components to the infant. We will go over the infant meal pattern requirements in more detail later. For the most part, the basic rules are breast milk or iron-fortified infant formula for every meal or snack. This goes until the child reaches their first birthday. Solid foods are required at the age of 6 months, as long as the following conditions are met. The child needs to be developmentally ready for solid foods, and the parent needs to be comfortable introducing the food item or solid foods at all to the infant. Solid foods must be served at a texture and consistency that is developmentally appropriate for that infant. This might mean the foods need to be pureed, mashed, ground, finely chopped, etc. Solid foods should always be introduced one at a time and gradually over the course of a few days. This helps track any possible allergic reactions to a specific food item. When feeding infants, you do not have to serve all of the food items at the same time during a specific meal service time. Infants should be fed when they are hungry over the course of the day. If the facility is claiming the meals served to infants, the facility may claim up to 3 meals. One meal must be served as a snack. So the facility may claim up to 3 meals per day per infant as long as all of the food requirement items are served for each meal or snack that is claimed. There are 2 age groups for infant meal patterns. First, we will discuss the 0 to 5 months age group. For this age group, facilities are only required to offer 4 to 6 ounces of formula or breast milk for any meal or snack. You can serve more if the infant normally consumes more. If the infant does not normally consume at least 4 ounces in one setting, it is okay to start with a smaller bottle. Until you offer at least 4 ounces, this meal may not be claimed. For example, if you offer and the infant consumes 2 ounces of breast milk or formula at 9 a.m. and an additional 4 ounces at 10 a.m., this will qualify as a reimbursable breakfast for this infant. Make sure to properly store breast milk to prevent it from going bad in between feedings. If a baby does not finish a bottle of breast milk at a feeding, then store it in the refrigerator for up to 2 hours. Do not give the bottle to the baby after 2 hours. Always ask the baby's parents what to do with the leftover breast milk. If a baby does not finish a bottle of infant formula at a feeding, then throw away the infant formula that is left in the bottle. A baby's saliva can introduce bacteria into the bottle, which can make the infant formula go bad and make the baby sick. If a child appears to still be hungry even after consuming the normal rate of consumption, you may want to discuss with the parents about introducing solids to the child. Never serve solid foods to an infant without the parent's permission. The second group is 6 to 11 months. When serving infants between the ages of 6 to 11 months, the meal pattern changes. It is important that the person feeding the infants and claiming the meals understands how much of each component is required and which foods are required. Breast milk or iron-fortified infant formula must be served for every meal or snack. Whole milk served to the infant is only allowed if there is a special diet request, which needs to be completed by a recognized medical physician and on file at the site. Please contact CANS if you have any questions regarding the special diet process. At this age, the facility should begin to offer solid foods. Again, solid foods are only required when both the infant and the parent are ready. Facilities may only claim the meals when all of the food items are offered to the infants, provided that the child is developmentally ready and the parent is ready. We will talk a little bit later about how to document this. If you are working in a center-based program, for breakfast, lunch, or supper, you must offer the following: 6 to 8 ounces of breast milk or iron-fortified infant formula, 0 to 4 tablespoons of iron-fortified infant cereal or meat alternate, which we will discuss meat alternates on the next slide, and 0 to 4 tablespoons of fruit or vegetable. This is a list of the food items that may be served in place of the iron-fortified infant cereal for breakfast, lunch, or supper. This substitution is not allowed for snacks. 0 to 4 tablespoons of meat, fish, poultry, whole egg, cooked dry beans, or cooked dry peas. 0 to 2 ounces of cheese. 0 to 2 ounces of cottage cheese. 0 to 4 ounces or half cup of yogurt. It is important to know that you can only serve whole eggs. Serving just the egg yolk or just egg whites is not allowed. Keep in mind that if you serve yogurt, you must follow the sugar requirements of no more than 23 grams of total sugars per 6 ounces. For snacks, you must offer the following: 2 to 4 ounces of breast milk or iron-fortified infant formula, grain component, 0 to half ounce equivalent bread or 0 to half ounce equivalent iron-fortified infant cereal, 0 to 1/4 ounce equivalent crackers, 0 to 1/4 equivalent ready-to-eat cereal, 0 to 2 tablespoons of fruit or vegetable. Please be aware that the grain component must be whole grain rich, enriched meal, or enriched flour. If you serve ready-to-eat cereal, such as Cheerios, you must ensure that the sugar requirements are followed. Ready-to-eat cereals cannot contain more than 6 grams of sugar per dry ounce. As previously stated, if yogurt is served, it cannot contain more than 23 grams of sugar per 6 ounce of serving. Ready-to-eat cereal cannot contain more than 6 grams of sugar per dry ounce. Juice cannot be served and claimed for reimbursement if served to infants under 12 months. If adult grains are served, 1 serving per day must meet the whole grain rich requirement. As with the children's requirements, you must complete production records. The infant production records are required if you claim any infant meals for reimbursement. These records show that the meal pattern requirements were followed. CANS has 2 different prototype infant production records forms available for use. However, if your site chooses to create your own, it must be approved by CANS before use. The most common prototype of production records form used allows for multiple infant meals to be documented on the same page. This is ideal for sites who provide care to several infants. The second form is 1 page per infant and recommended for sites who do not care for many infants. Regardless of the forms you use, you must ensure that the following information is recorded: first and last name of the infant, age of the infant, whether either by where the infant is listed or by the age being recorded, number of each food item offered, and the type of each food item offered. So in the next slides, we will break down how to complete the group infant production record. So in this example that we are using, the group infant production record is what we are using. First, review the infant ages, birth to 5 months. Please take note that the date and center name is recorded at the top of the form. You can pre-list the infant's name. However, you cannot add the eligibility code until you are consolidating the meal counts. These codes include infant claimable for free, reduced, or paid meals. See the CACFP meal counting requirements training for more information. In this example, in the breakfast column, we have mom listed for Jane Smith. This shows that the infant's mother came to the site and breastfed. If the infant's meal is claimed for reimbursement, mark the box. Now let's review the infant ages 6 to 11 months section of the production record. Like the infant's group, birth to 5 months, you can pre-list the infant's name. However, you cannot add the eligibility code until you are consolidating the meal counts. Once again, see the CACFP meal counting requirements training for more information. In this example, for the breakfast column, be sure to record the cereal or meat item as well as the fruit or vegetable item. In order for the meals to be claimed, you need to ensure that all food components were offered and the amounts recorded and that the box is indicated. A common question that we get is, are we reimbursed for the cost of the formula in infant foods? The reimbursement structure is the same as that for the older children. Your center is reimbursed at a rate per meal snack provided that you followed the meal pattern requirements for the infant. The rate that the center gets is based off the eligibility category the infant is approved for, as with other reimbursements. There are 3 exceptions to this, which includes infants enrolled in early Head Start or infants in emergency shelters. These sites qualify for all the free rate. The other exception is daycare home providers. The reimbursement structure for daycare home providers works differently. Please contact CANS for more information. The other thing to remember is that no more than 3 meals may be claimed for reimbursement per infant per day. In addition, if 3 meals are claimed, at least one of the 3 must be a snack. In other words, a facility may not claim breakfast, lunch, and supper for one infant. One of those 3 would need to be claimed as a snack. Note that emergency shelters may claim 3 meals without a snack, but that they are the only facilities that may do this. Team Nutrition, an initiative of USDA, supports the CACFP by providing training for child care providers, nutrition education for children and families, and resources to support a healthier environment. Child care centers that participate in the federal children nutrition programs can request materials. Please contact CANS for more information or questions. As a reminder, all records, including infant records, must be kept on file for 3 years plus the current year. And here is our non-discrimination statement. And as always, please reach out with any questions and comments, and thank you for watching.